Hi, I thank SAGES for allowing us to present our results from our cost utility analysis, and thank you for saying that long title for me. These are our disclosures. Treatment options for achalasia include endoscopic botulinum toxin injections. This usually is a series of 2 injections 1 month apart of 100 units along 4 quadrants. It has decent immediate efficacy of about 85%, but it's very short term and doesn't last longer than 6 months to a year in most patients. Pneumatic dilations has been well studied and is a good treatment if it's done appropriately and well. And this usually takes 2 to 3 serial dilations, graded sized balloons, starting from 30 millimeters, 35, and then 45 millimeter balloons. And with a forceful dilation, you can get up to 93% immediate success rates, and these will last pretty long, but then the efficacy decreases over time, and most people will go on to require further dilations or other treatments, including myotomy. And there are significant complication rates that come with each dilation, from 2 to 30% perforation rate, depending on what study you're reading. And there's a significant rate of reflux that comes along with this as well. Laparoscopic myotomy, we know, has been shown to be very safe and also very effective. There's minimal morbidity with a less than 1% clinically relevant perforation rate, and the reflux rate is about 40%. The response rates get up to near 100%, and this is a long-lasting efficacy. And pearl endoscopic myotomy, as you saw recently, has a very good efficacy and response rate. It can be 95 to 100% immediately. And in a recent study of 3 to 5 year follow-up, we actually see that these are long-lasting effects. Complications, again, are minimal, a 2% bleeding rate that requires further intervention, and about a 40% reflux rate as well. Our experience with POEM at our institution, we've done over 100 since 2011. We've done a recent questionnaire follow-up and found 85% of our patients are dysphagia-free. 97% have required no further treatment, and we have about a 4% significant complication rate. So because in the last 4 to 5 years, we've come to adopt POEM as a treatment for achalasia, we wonder what the cost of POEM is related to other treatment modalities, and also what the value given the efficacy of the procedure. So we proceeded to do a retrospective review at our single institution. We compared total cost of laparoscopic myotomy, POEM, pneumatic dilation, and botulinum injections. Adjusted all the costs to $2015, and we looked at overall comparative costs, setting the cost of a lap myotomy, as we know this is a gold standard treatment, equal to 1, and looking at the cost of each other procedure in comparison. We looked at this per visit as well as per treatment, and we calculated incremental cost effectiveness ratios, which basically is the difference in cost divided by the difference in efficacy when you're comparing 2 procedures. And we counted a QALY, which is a quality adjusted life year, as 1 year being dysphagia-free for an achalasia patient. We also looked at the comparative cost over time. So when we look at comparative cost, we found set cost of laparoscopic myotomy to 1. The cost of the POEM was very similar at 1.058, and the standard deviation of the means of the cost between the two were also similar, around 40%. The cost of pneumatic dilation for 1 dilation was about a quarter the cost of a laparoscopic myotomy, and this was similar to the botulinum injections. And the standard deviations for these costs were quite huge, and I think that's related to the difference in utilization of resources within the GI suite. Length of stay between the laparoscopic myotomy and POEM, similar again at 3 days, and 1 day for pneumatic dilation botulinum injection, which is expected because they're usually outpatient procedures. comparative cost per treatment, we then took botulinum injection, multiplied the cost by 2, as that is the number of injections required to get optimal efficacy, and for dilations, multiplied the cost by 2.3. We found that to be the average number of dilations most people required. And that brought the cost of dilation to over half the cost of a myotomy, and the cost of botulinum injection near to half. The efficacy rates that we found most reported in the literature are here over time, and we use these then to calculate our incremental cost-effective ratios. In America, for probably the past 15 or 20 years, $50,000 per quality has been an accepted benchmark for value. And so any procedure that costs less than $50,000 per quality is considered cost-effective. When we compared POEM, which was equivalent to lap myotomy, to pneumatic dilation, at 1 year it cost $52,000 per quality more than the dilation, and compared to botulinum injection, it cost $20,000 more. So at this point, POEM and laparoscopic myotomy are more effective or more cost effective than botulinum injection, but not yet more cost effective than pneumatic dilation. At year 2, the difference in cost effectiveness between POEM and pneumatic dilation dropped to $15,000, thus bringing us under the benchmark, and botulinum injection to just at $6,000. And by year 3, it improves even more at $7,500 and $3,000. When we look at cost per cure, we calculated the cost of the treatment divided by the efficacy, and then looked at that over time. You can see the trends between the POEM and laparoscopic myotomy are very similar, almost the same, and the trend of the pneumatic dilation also is very similar, although the initial cost is less. And at year 4, they're coming very close, and by year 5, they will merge. Botulinum injections, the cost per cure remains stable over 3 years, and after 3 years to the 4th year almost doubles because of its efficacy reaches almost 0 at that point. POEM we found to be equivalent to laparoscopic myotomy in cost, and the previous presentation showed that it's equivalent in efficacy as well. Pneumatic dilations have been shown in multiple studies to be cost-effective across time, and we found this to be true as well. Although things we don't calculate into our cost-effectiveness analysis are the costs of further treatment, more dilations, the perforations and complications that come with that, multiple trips to the hospital, missed days of work are things that aren't calculated into what I'm reporting today. And botulinum injections have the lowest initial cost, but we've seen myotomy, either POEM or laparoscopic, actually is more cost effective even at 1 year than an injection because of the efficacy rates. In conclusion, the economics of achalasia are complex. Botulinum injection should be reserved for patients who either can't tolerate myotomy or have a life expectancy of less than 2 years. And pneumatic dilations are cost-effective treatments, but we should consider the further costs that will come down the line, and the fact that some of these patients will require myotomy even for persistent symptoms. And at 4 years, the cost analysis actually evens out between POEM, laparoscopic myotomy, and dilations, and that finally POEM and laparoscopic myotomy are effective and economic treatment options for achalasia. Thank you.